what's up, Kelsey? We're doing a follow-up interview with you. How are you today?
I'm great.
That's good, that's good. Okay, so we talked about three things that we're going to talk about today. Do you remember what they are?
I think you were saying.
Just kidding, that's a trick question. We didn't talk about anything like that. Okay, so actually I wanted to talk about mental health awareness today. Also wanted to talk about things that you like as your hobbies that make you unique, make you a different soul than every other one out there. Also, I want to talk about um, undiagnosed. Well, like I want to talk about illnesses that usually go undiagnosed when people kind of just like ignore them. They're non-life threatening and everything.
Okay.
Yeah. So, um, real quick, I know that you are a PT, which is a physical therapist. Give me three things that you like about being a PT.
Number one, I love to empower patients and their families. Well, yeah, it starts with the patient, but the family is a huge dynamic of that and can have a big impact, especially in the home care setting or pediatric setting, which is where I work. And yeah, that's awesome. Number two, maximizing patients' independence. Number three, definitely expanding upon their quality of life. So you can really make a difference on someone's quality of life. A huge part of physical therapy is intervening on someone's pain, and pain can be a big factor in what causes them to not participate in the activities that they love. It can interfere with them from completing their job tasks and requirements, and those contribute to people's quality of life. So physical therapy can really make have a big impact on someone's overall well-being. So
Okay, awesome, nice. I really like that answer. Okay, well, do you know anything? I know with physical therapy it's a lot of school, so I know that you have to have a lot of knowledge to finish that and see it all the way through. And then a lot of things I know I watch a lot on YouTube are assessments that PTs do. Just like, do you know any like type of like? I'm just looking at all the different things they do. They talk about different parts of the body. I think you know that I talk about different parts of the body. Do they teach you like certain parts of the body?
Yeah, oh yes. They teach in-depth anatomy,
Okay.
origins, insertions, innervations,
So
all.
like if somebody hurts a certain part, like their arm or leg, then you know like maybe how you can treat them.
Yes, we do upper quarter and lower quarter exams in the outpatient setting. We also do that in the home care setting. We have the referral from the physician typically, but sometimes we don't because it's a direct access state of Michigan. So that direct access means that a person can access physical therapy services without a physician's referral. So you can go to a clinic and you don't need to go to a doctor first.
Okay.
However, insurance needs to reimburse for ongoing treatment sessions. So a lot of times, unfortunately, different insurance companies, they require physicians to co-sign or to sign off. So we need a script from the physician. So that kind of is annoying for physical therapists because we are doctors of physical therapy. We go to school for at least for like 3.5 to 4 years, in addition to the 4 years of undergraduate schooling.
Yeah.
So I went to Michigan State, got my bachelor's in kinesiology, and then I went to Grand Valley and got my doctorate in physical therapy. So a total of 8 years, and studying for boards. Even to get into physical therapy school, it's very competitive. It definitely is just as competitive as medical school. You take physics, you take chemistry, you take human bio, anatomy, physiology, all of the things that you do when you're trying to get into med school.
Okay, awesome.
So, but once you're done, it's a very well rewarding profession.
Yeah. It sounds like it, yeah. Very good. Sounds like the outcome is like what you would want it to be. Like why you started
Yeah,
going into it in the first
I
place.
love it because and you have to do a lot of job shadowing before you even go to apply. Because they want you to really get a feel for like what the day-to-day work life would be, and so you have to have job shadowing. You also have to have volunteering in some way, shape, or form related to the field. So they want to know that you're well aware of what the job would look like and what the program would be, what it would entail, because it's so strenuous and it's very it's a lot. They try to weed people out before they even accept you in the program because of the fact that it's not an easy program. It's not an
Yeah.
easy road. So they really want to make sure before accepting you into a physical therapy school that you're someone that really wants to do it.
Okay.
But I loved experiencing physical therapy from the patient standpoint
Yeah.
when I was young. So that's how I got introduced to the field. And I was like, I want to do this because it's not a desk job. It's like some paperwork, yes, documentation, but you're interacting with people, and I love that.
Makes sense. I've always liked working at a desk. I know people like more hands-on, and work goes by way quicker when you're hands-on too, so I get you there. Also, you said that you weren't medical. You said physical therapy, but that's not medical. So like I'm thinking, so you don't talk about a lot of things that I would be discussing in the video, like neuropathy and neuromus, and are those things that they taught you? Like I
Oh,
know
for
that's,
sure. There's
and
even
then I know with biology, you're definitely really good with biology too, right?
yeah.
For sure, for sure. So I'm gonna quiz you a little bit.
Oh no.
We're gonna quiz Kelsey.
This has been a long
Let's go.
time since school.
No, she's got this. So this is gonna be fun. I never brought anything to like. I don't know what we're gonna do for like what she gets wrong, but we're just gonna go spontaneously here. So, but we'll go into the second part of the interview. For that part, would you mind taking off your shoes?
Sure.
Awesome. Thank you. Beautiful Kelsey, size 6. Returning model for our channel, The Scouting Report. Everyone, please follow, subscribe. Okay, so, wow. Looking great as always. Always amazing. Such a sight to see. So, I like to talk about neuropathy, which is a malfunction of your nervous system within your hands and feet. And neuromus is when you get compressed nerves between your toes, and that is something that can be relieved. It is not permanent or life-threatening. And then also, I like to talk about right here, I don't know if you know, but we're going to talk about intrinsic muscles a little bit and extrinsic. So intrinsic starts within one part of the body, and then the extrinsic starts from another and then extends into another part of the, like in that part of the body. Okay, so your calcaneus would be located here on the bottom of your foot. This would be right there. And then if calcium deposits build up on the bottom of your heel bone, then you can get heel spurs. And then, so, heel spurs don't really give you any pain itself, but it can just irritate your plantar fascia, which can give you plantar fasciitis. Yeah, but, okay, great. Do you mind putting your feet side by side for a second? Cool. And then, can you scrunch your toes for a second? That's spreading them, but they look great. Is that hard to do?
Yeah, because I have arthritis in my great toe.
Do you really? Okay, no problem. So does that bother you at all?
So I was a dancer and I was on point shoes, so yeah. It hurts this side. But
How long were you a dancer for?
since like 4 years old to 17 years old.
Okay,
And then I was
wow.
a cheerleader.
Nice. I see you have a very nice physique, like your bone structure, like your body shape. Definitely very nice.
Thank you.
Absolutely. What do you do to like stay in shape now? Like, how do you keep yourself in shape?
I honestly, I'm blessed with a really good fast metabolism. I
Mhm.
am a big eater, so I eat a lot of carbs. I eat a lot of like, I don't know, I could improve on my diet, but that being said, I love yoga. I have a lot of energy, so um, I like to run and I
Mhm.
like to do yoga when
Like
I
the
can.
Yeah. How often do you do yoga? I know you do that often, and you
Yeah,
like can do it for hours sometimes, right? Like,
yes, because it's not so strenuous.
I think this is good for people to hear because there's more people out there who like doing yoga for like hours and stuff.
Yeah, it's not super
Could
strenuous
you
like
cross your feet right
cardiovascularly.
over left or left over right? Cool.
And so it's not like super taxing as far as like cardiopulmonary systems go. It's like a lot of calming meditation.
Mhm.
And so you can tolerate a lot more.
Okay.
Um, so yeah, as a physical therapist, you learn a lot about activity tolerance, and sometimes people that have compromised pulmonary or respiratory systems, they are like totally not able to even do day-to-day tasks without needing rest breaks. Um, and so a lot of that's to do with like having conditions like such as emphysema or COPD, different
Mhm.
types of COPD. So yeah, I'm very thankful that I have asthma, but yoga helps with the aspect of calming my brain, and it's like mental health. It incorporates your mental health and your physical.
Okay. Cool. Cool.
Yeah.
Do you want to ask you? So today we had like a like what 9 hour workday maybe.
Yeah.
Okay. So how often would you say in a day would you go barefoot? Like how many hours?
Well, now that I've been working with you, um, I don't go barefoot that often.
Mhm.
Feels super good to take my shoes off.
Yeah, maybe a little bit more lately.
Yeah, for sure.
Honestly, when I met you and started to get to know you, I was like, this girl's gonna be really cool because she's barefoot often.
Yeah, when I take my shoes off, like in my apartment and stuff. Yeah, for sure.
Can you put them side by side? And then we're gonna do some exercises real quick. Okay, so can you scrunch them like make a fist? Is that hard to do?
No, that's easy.
Okay. And then can you spread them again? But like, and then that's difficult, not too difficult.
It's kind of difficult on this side.
And then can you scrunch them again?
Okay.
Okay. And then can you cross them and make a fist? And would you say how many days in a week would you eat vegetables? Do you say
Oh, almost every day. Like
almost every day?
6 days a week.
What about like fruits?
Same thing.
Is there someone that you admire most in your interpersonal circle that you go to?
Um, yeah. My really good friend Trisha Wilson, she's awesome.
Nice, nice. Okay.
Or Trisha Feldman now. She's a really cool person. She's a dancer and grew up right down next door to me, like on the same street. And we became really close because we both dance and we both have a lot in common as far as like our upbringing and things. And she grew up in Detroit. We
Okay.
have a lot in common.
Do you have any takeaways from this interview?
Um, yeah, Aaron's awesome. He has a lot of insight, he asks a lot of good questions.
Mm.
I think that you inspire others and like incite a lot of thought processes that a lot of people don't. So
Appreciate that. You use my name often. I'm gonna have to edit that out, unfortunately. I don't know. I just don't really just share that information with everyone. But that is nice feedback. Thank you for that. Also, I wanted to ask you, so with the things I talked about, like the malfunction of the nervous system and like things like that, have you ever heard of things like that after now that I talked about it?
Mhm.
Okay.
Oh yeah.
Did you study stuff like that in like,
Oh, for
the
sure.
different body parts? Okay, so
Diabetic neuropathy is a thing too.
we said we were gonna quiz you, so are you ready? So, what is neuropathy?
Neuropathy is decreased sensation to the distal limbs of the body. So um, it's part of the PNS, not the
Ooh,
CNS.
wow, dang, she
CNS
got
is the
it.
central nervous
That
system.
was too easy. Hold
PNS
up,
is a
hold
peripheral.
up. Okay, okay.
It's
Nice.
yeah, a lack of input to the brain. So decreased
It's your golden eye.
sensation, decreased tactile input to the brain. So because of the faulty nervous system, when people are touching things, they're not going to have the same input back to the brain
Okay, great.
to tell them what it is.
So, do you remember what heel spurs are?
Heel spurs or calcaneal buildup.
Yeah, you got it. You
Calcium
know
buildup
it.
to the calcaneus, but it's also like, yeah, other spots. But
What about,
neuromus.
we talked about that one, plantar fasciitis, or plantar fascia.
Fasciitis. Okay, so the plantar fascia, it inserts here and then just spreads like this. Fascia is like the outer layer. It's a thin, like tissue paper like layer to muscles. It encases them. And the plantar fascia can get really irritated when you're constantly gripping the muscle.
Okay, everyone, she got it. It's good she did because I had nothing to do to her if she got it wrong, so. Well, here you have it. She's a PT major, graduate, doctor basically, so that's why she basically just started spitting terms when I talked, so.
I talk about it all the time.
She gets an A, 100%. So, yeah, well, that's pretty much it. One last thing before we go.
Okay.
Can we do more stretches?
Sure.
Okay,
What kind of stretch?
same ones. Same ones. Before.
What stretch? Spirit.
Okay, perfect.
Oh shit.
I don't even care. So can you scrunch them for me like that? How they are right there? Yeah, scrunch them and then spread them. Okay, and then can you touch your right foot onto your left leg? Other way. Yeah, and then show the bottom. Perfect, perfect. And then you were a size 6. And then can you hold one up? Like, can you bend your knee and hold one up? Hold like one foot up and show your bottom of it. Can you like hold a leg up and show the bottom like towards the camera? It's hard to explain, but perfect. Okay, can you do it with the same other one?
This is a yoga move.
Yeah, perfect like that. Okay, again with the other. But like, just hold it out there. Okay, perfect. Okay, never mind. Okay, well.